Good afternoon, everyone, and let me thank you for joining us today. Before we get started, let me welcome everyone and celebrate, of course, opening day here in Colorado and throughout the Major League Baseball League. We also want to say to our Colorado Rockies the very best of luck this 2020 season. With me today, of course, is Bob McDonald, Executive Director of the Denver Public Health and Environment Department. Since March last year, we have generally referred to our periodic briefings as COVID response updates. But today, I want to talk about COVID recovery. Let's start off with some really good news. We have President Biden's American Rescue Plan recently passed by Congress, and now the American Jobs Plan focused on infrastructure, which I hope Congress will move expeditiously to pass as well. Today, I spent time with mayors all over the country, along with the U.S. Department of Transportation, talking about the new bill and making sure we got all of our questions answered. We're now moving forward to do everything we can to expedite the passage through Congress. These two bills are the bold action we've been asking for from our leaders in Washington for some time now. Delivering on that action will provide the foundation we need to move from rescue to recovery. It's the foundation we're going to build on here locally in the months ahead, particularly as we get more people vaccinated and get our economy moving again. Per the governor's announcement on Monday, everyone in Colorado, 16 and older, will become eligible to get the vaccine starting tomorrow. A mass vaccination site over at Ball Arena opened today as well, and that will mean thousands of vaccines getting into the arms of Coloradoans. We're also continuing to get vaccines out to residents in our underserved communities through our fixed community sites. Now, 6 sites in the city where we are looking to expand hours of access. Bob, of course, will be providing a status update on our community sites here shortly in Denver. Now, this is all great forward momentum, but even with these positive steps, we simply cannot ease up just yet. I say this to remind everyone that we can just as easily find ourselves in another surge if we move too quickly or start thinking that this virus is under control enough to drop our guard. And there are warning signs we need to pay attention to, not just nationally, but here in Colorado and in Denver too. Cases have been ticking up. At best, we've plateaued at a stubbornly high rate. And while our positivity rate has stayed below 5% since January, it has also been inching up over the last several weeks. Social distancing, not gathering large groups, and wearing your mask, these are all the things we need to keep doing until more people are vaccinated and we can confidently say that we've prevented another surge. Are we getting closer to that point? Absolutely. Every day we're getting closer. Are we there yet? Not quite. Around mid-April, the state has said they will begin to return control of preventive public health measures back to local jurisdictions. With the size of our population, with the density of our urban core, and as the hub of the metro area, we're going to take appropriate steps here in Denver to ensure we keep moving forward. Some are already probably beginning to look at the state's timeline and think this means it's open season. Well, we caution against that. We believe it's the wrong way to look at it. People who live, work, and visit Denver should expect certain measures such as capacity limits and our mask order to remain in place until vaccination rates and case rates are where we need them to be. What that would look like is being determined by our public health experts now, and we'll be sharing more about that over the next few days and weeks to come. Right now, I will say that once these measures are handed back to local governments to oversee, we're looking at a phased easing of limits that will be based on the state's dial system. We're looking at the same phased approach to our mask order, where it will be in place at least through early May for indoor settings. And then we will evaluate when and where masks will be required on a month-to-month basis. We are all engaging in, of course, our regional partners on this because Denver isn't an island. And coordination across the metro area will be key to maintaining people's health and safety during this transition. As we've done since the beginning of this response, we prefer, of course, to coordinate in a regional way, if we can, in these situations. We're close, folks, to that goal line. So we have to protect the ball. We must not fumble it We must get across that line and get this done. So please keep wearing your mask, keep social distancing, not gathering in large groups, keep washing your hands frequently, and get your appointment scheduled for the vaccine. With that, let's turn it over to Bob McDonald.
Thank you, Mayor. Thanks, everyone, for being with us today. I'm going to go through a slide deck here to give some updates, and I want to start where I normally do, looking at the national landscape. If you take a look at this map, this was just a few weeks ago. Take a look at the northeast part of the country and the northwest part of the country. You see that some states are turning red again, meaning that they're at elevated risk of outbreaks. They're in outbreak status. And when you take a look at the next map, on the next slide, you will see that another state, looks like Minnesota, has now turned red. And up in the northwest, Washington has also turned a darker color. So again, we are not out of this. We do not want Colorado, and certainly not in Denver, for numbers to start peaking again or start spiking again. Let's take a look at the next slide here. I think that, there we go. So focusing on Denver here, we are currently in the yellow phase of the dial. You can see throughout the state here that there's quite a varied groupings of counties that are different phases of the dial. We'll talk about what it looks like for Denver when the state devolves the dial to local public health in just a minute. With the next slide here, we'll take a closer look at the epi curve for this, again, dating back to the beginning. And you can see the spike that we just went through during the winter months. But what I want to call out now is take a look at the tail end of that epi curve. You see how it dropped to level yellow, and now it keeps hovering around there. We have plateaued here. Cases are not going down like they were. It's leveled off. That means that we are just barely keeping pace here with the number of vaccines that are taking place and the number of cases that we see stemming from variants of the initial virus. On the next slide here, just a reminder of what the dial looks like. These are the main metrics that we take a look at. These are not the only things that we take into account in making informed decisions, but data, we're going to continue to be data driven. Positivity rate has gone up, and so that's also a concern, and we're keeping an close eye on that. On the next slide here, you will see just some recent revisions that the state made to the dial system, largely easing up in the blue and the green phase of the dial, making it easier for local communities to get into the blue and green phase, but we still have to be careful. And I'll talk about how we might transition over the upcoming months as the state eases up on the dial requirements. On the next slide, I want to talk a little bit about vaccines. The city has done some great work getting thousands of vaccine doses into arms of our underserved populations. We need to do more. We're going to continue for that to be a focus. You'll see 4 of the 6 sites that the city stood up. These are the 4 that are managed primarily by the city. We have 2 others that we are working in collaboration with partners. But you can see here the thousands of doses that have taken place already. As more becomes available, we're going to push those out and try to make these sites operate every day of the week. Next slide, please. We want to see more of these individuals here turn orange, from blue to orange. We are getting there. We expect tens of thousands of more doses to come in the upcoming weeks. That'll play a huge role in what we do with the dial and the level of restrictions moving forward. I want to spend a little, if there's one point I cannot hit home enough today, it's that everybody has to get vaccinated. It's important to understand that getting vaccinated isn't just to protect the individual, it's to protect everyone. Because the more people that are unvaccinated, the more people can be infected in our community. The more they become infected, the more infections we have, the more the virus mutates. The more the virus mutates, the more risk that we run for the current vaccines not to be effective because the virus has mutated too much. So get vaccinated. They are safe. That's been proven. They are very effective. Again, it's not just for the individual. It's for everyone in our community. We don't want to get to that point where the virus mutates too much, and then we all have to go back and get vaccinated again. We have to get a different type of vaccine because it mutated too much. So do the right thing here. It's a call to action here. Everybody get out. As these doses become available in large quantities, get scheduled, get vaccinated. That's the quickest way to get through the pandemic. Next slide, please. So until then, stay the course. I can't stress this enough. Face coverings are important until you can get scheduled for a vaccine. This is our vaccine here. You don't need to wear two, but you need to wear it properly. We all need to. I need to. Wear it over the nose, over the mouth, not hanging from the ear or below the nose or below the chin. That's the only way that's effective.
Let's get started.
With that,
Alexandra?
I'll turn it back over to the mayor to open it up for questions.
Or Luis?
Bob, let's go ahead and do Q&A. I think we're set up for it now.
Alrighty. We have 9 News next. Do you have a question? Alrighty. Let's get started. Alexandra? Alrighty.
Or Luis?
Conrad Swanson?
Alrighty. We have 9 News next.
You will have to unmute yourselves. Alrighty. Linda Shapley?
Alrighty.
She may have dropped off.
Conrad Swanson?
Vinny, do you have a question?
Yes, Teresa, can you hear me today?
Yep, we could hear you.
You will
Okay,
have to
great.
unmute
This is
yourself.
Vinny Del Giudice at the Bloomberg News in Denver. This is for the mayor regarding the pandemic and the economy. The pandemic has hammered the U.S. economy. The White House, as you noted, is responding. One of these things is a major infrastructure program. How will this program help DIA, a critical hub for the West, and other infrastructure in the city? Thank you very much.
Great question. We'll start with the DIA. Well, first of all, let me give you a general understanding that as we see it in terms of investment infrastructure. For as far as I can remember, investing in infrastructure is one of the quickest and most effective ways to help the economy rebound. We have done it here in Denver time and time again. Most recently, of course, coming out of the Great Recession. Just so happens that right before the Great Recession, Denver passed a $500 million bond. As part of our recovery strategy for the Great Recession, then Mayor John Hickenlooper expedited. Remember, investing in infrastructure is one of the quickest and most effective ways to help the economy rebound. We have done it here in Denver time and time again. Most recently, of course, coming out of the Great Recession. Just so happens that right before the Great Recession, Denver passed a $500 million bond. As part of our recovery strategy from the Great Recession, then Mayor John Hickenlooper expedited the investment of those dollars to help build up infrastructure, keep companies working, and put people back to work. At one time, the city of Denver was the only entity really building anything in our economy, but it kept the cycle, the construction cycle, churning. I'm glad that President Biden and his administration recognize the importance of infrastructure investment. This is not something that is critical just because of today's economy, but I've always believed it's the fastest way to create jobs and move the economy forward. And by making such a critical investment, at this point in time, I can tell you it's just absolutely a very, very, very smart thing to do. With regards to airports, as part of this infrastructure plan, there is a great deal of money set aside for terminal improvements in airports across the country. And as a big advocate for aviation and airports, we talked with the administration today about some of the capital projects, beefing up the airport improvement program, which is really the grant program to fund improvements at airports all over this country. And so mayors and airport leaders across the country are very excited about this because our airports took quite a beating, of course, during this pandemic. And the reality is that we've got to find a way to spruce up, to beef up travel industry, the travel industry, of course, aviation industry. And by investing in our airports, we keep, again, people working and we keep the economy moving around the aviation industry. So I can tell you that every mayor on the phone today that I was a part of was pretty excited about the investments in airport and terminal capital projects.
Thank you very much, sir.
You bet.
Esteban, do you have a question?
Sure, yeah. Mayor, can you talk a little bit about what other, things might stay in place a little bit longer than the state? Obviously, you mentioned some of the factors behind why face coverings might be might be mandatory through at least through May. Can you provide? Are there any other things that people should expect that may be in place for Denver longer than the state?
Yeah, what I'm going to do is I'll let Bob talk a little bit about that, but let me share with you, just because we're taking the state's handing over the baton, if you will, with regards to our ability to manage ourselves through the dial, we're still going to let data and science guide us. As Bob pointed out, we are still yellow on the dial. The goal, of course, is to get to blue and blue to green, where we have a full-blown economy humming and people are safe in their place, no matter where they are, at work, in restaurants, out on the mall. And that's our focus, right? But we got to allow this to guide the data and the science to guide us. And so mask obviously being the most obvious thing, and of course limitations in space that we've mentioned in the presentation is going to be critically important. I'll let Bob talk about other areas that might be impacted here as well.
Well, you know, I think nothing has really changed in terms of what controls this pandemic the most and what controls the spread of the virus. So certainly, you know, requirements regarding face coverings indoors. Perhaps we will take a look at easing up the restrictions or the requirement for outdoor settings. We will get a bit of a seasonal break here. We know that the virus does better in colder climates, and we just saw that, right, through November and December. So we'll take a look at whether or not, you know, we still need to keep face covering requirements in outdoor settings. Certainly capacity limits. We don't want to go from yellow level restrictions to nothing. And remove face coverings at the same time. That would be a mistake. I think that's what gets us back in the wrong direction here. That's what facilitates another surge. So we're going to be looking at what venues do we need to keep some capacity limits in, what venues do we need to keep face covering requirements in, and we are working very closely with our regional partners so that there's consistency and easy to understand, not just for regulated businesses, but for citizens, for all of us. We want to make it straightforward, easy to understand, and we want to have a path, a logical path to ease out of the dial a little bit slower than just lifting all of the dial restrictions on April 16th.
Alrighty, are there any other questions?
Teresa, yes, this is Vinny. I have one more for both of the gentlemen. We're on the 1-year anniversary of the virus now. What are the one or two things that you have taken most to heart that you find useful and will prepare perhaps the city or the state for future emergencies? Thank you very much.
Yeah, Benny, great question. I've been asked that question several times over the last few days. And I'll tell you, one of the first things is, of course, the resolve and resiliency of the people of Denver. When asked to do something, the people of Denver complied, and I think as a result, we're not doing city-to-city comparisons, but we've got to be awfully pleased with how Denver has come through this. One life lost is too many. We've lost over 530 lives today so far. And we mourn the losses of those souls and, of course, the impacts on their families. As we continue to move forward, I think that we learned a lot about our systems in the city of Denver, how we respond to these biological and natural type challenges that we will have been faced with, and how best to respond and coalesce around working regionally with our partners as well as with the state and the federal government. And how we need to make sure that we continue to do things necessary to prepare for these unexpected events. January 1, we were pleased with our standing and where we were economically, but also with our fund balance, our savings account. Thank God we had it in place, because come March, we had no idea how decimated that savings account will be, because we had to make sure the city got through this when our revenues were severely disrupted. Bob?
Well, I have to say that the number one thing that came to mind, I think the mayor already touched on, and that is that it takes everyone. You know, from the beginning, it took all of our partners throughout the city, partners external to the city, the private sector, every individual in the city of Denver. It takes to get through this, and that is just reinforced even more now with me, as it goes back to what I said earlier. Everyone needs to get vaccinated for us to pull out of this as soon as possible so that the virus doesn't mutate. It takes every individual, every step of the way. Even more important now, during the vaccination phase.
Let me add one last thing to that. About 3 years ago, we asked ourselves a question that if Denver faced a disaster, were we prepared for emergency operations? And unfortunately, that answer came back no. And so we went about the process of instituting new leadership and a new team in emergency management. And we began the process of practicing, if you will. We would spend days at a time in the bowels of this building going through simulations and how we'll respond. What's the role of the mayor, the role of Bob McDonald, the role of the Department of Transportation Infrastructure, Fire Department, Police, everybody, what's your role? And we didn't know then, and sometimes we would begrudgingly go in that basement. We didn't want to do these practices, again, these simulations. We were tired. We didn't realize how important they would be. The day we had to show up in Emergency Operations Center, everyone knew their place, they knew their roles, and as a city, we were able to hit the ground rolling. So if there's something, Vinny, we take away from this, keep practicing. It's better to keep being prepared so that when you have to, you don't have to get ready. Stay ready so you don't have to get ready.
Thank you again, gentlemen. Thank you very much.
You bet. Okay, that's it. All right, we're going to thank everybody for joining us again. Again, go Rockies, and we'll see you next time for the next update.